Thank you very much, Mr. Williams, and good afternoon to all who are viewing and listening to today's briefing. As we have heard from the CMO and the Medical Chief of Staff, we are currently following active cases of COVID-19 within our communities. We knew that this would, and we have been preparing for this to happen. So yes, we are following active cases within our communities, and we're asking persons to stay vigilant of the protocols. But as indicated, we have been preparing. And how have we been preparing? By providing with the necessary information pertaining to the virus. Since about March of 2020, we have been here week after week providing you with information on the COVID-19 virus, and not only just getting us prepared, but getting you prepared in actuality. The doctors have been here speaking to you and telling you about the non-pharmaceutical measures, and they have been reiterated again. Social distancing, wearing your mask, hand sanitizer. I make sure I keep a hand sanitizer in my bag, in my vehicle. I always have my hand sanitizer. My masks are always closed so I can grab and go. And that's what we need people to begin to do. Again, we are appealing to you to follow the measures. The measures that we must adopt, and this is the measures that we must continue. When we spoke to you about these measures, we would have indicated that these are the measures that must be adopted until vaccines became available and we are able to build the herd immunity required for us to be able to get back to some level of normalcy. When vaccines were identified to be in final testing, the doctors again came here and educated the public on the various vaccines and the technologies that were used in each of the potential vaccines. When we confirmed the use and secured the Oxford AstraZeneca vaccines, we again came to you and spoke to you about the vaccine chosen and took it even further, where the Ministry of Health made available a number of our doctors, nurses, and health educators who have actively engaged in a number of more interactive sessions at various institutions, businesses, and anywhere persons requested these education sessions. At these education sessions, persons were able to ask questions and seek clarity in order to make an informed decision on whether they would take the vaccine. These interactive education sessions continue, and all you have to do to request to have someone come and speak with you is to call 311, and our team is readily available to assist. At this point, we are now at our 60% mark of us who are well on their way to being fully vaccinated. To those persons who would have made the decision and step forward and have been vaccinated, we say thank you. You are doing your part to help in our fight against COVID-19. It is also important at this point to thank our hard-working team at the Ministry of Health. We have all been working extremely hard to keep our country safe. Our nurses, our doctors, our contact tracers, giving their all to ensure we keep our country safe, doubling up efforts at times so to balance their regular duties and our regular health services, while at the same time offering the vaccines, testing, and going through the contact tracing exercise. However, I want to assure the general public that our healthcare system is robust based on the investments that we have made in it. and it stands ready to combat any significant number of COVID-19 cases. We are hopeful that our system will not become overwhelmed, as we know the majority will to do the right thing and get vaccinated. At the Ministry of Health, we still have an adequate supply of ventilators, oxygen concentrators, PPEs, testing reagents, and testing kits for COVID-19. And so we've made sure that we prepared ourselves. I want the public to understand vaccines everywhere around the world right now is commodity. And to tell you that India, which is one of the largest manufacturers for the vaccines within our supplying to our region, is no longer exporting vaccine. It's just the reality at this time, as they themselves are dealing with their own crisis. However, I want to assure the public that the Ministry of Health continues to work behind the scenes to secure more vaccines. As you have heard, the current batch of vaccine we have would expire on June 30th. At this stage, based on the numbers, we do believe that we're able to use all of those vaccines by June 30th. But we are working assiduously to ensure that we are able to secure more vaccines and exploring every option possible. And we are confident that we would be able to receive more vaccines in short order. And so I just want to make the plea once again to everyone. Take advantage of the opportunity to become fully vaccinated. Again, the virus is in our communities. The way that we would stop the spread of the virus and the effect that it would have within our communities is by making sure that we are able to achieve herd immunity. We have a greater number of persons vaccinated. Those of you who are listening are pleading with you. The non-pharmaceutical measures are also still very important and relevant at this time. Please remember to wear your mask from you leave your house in the morning until you return to your house in the evening. Please remember to keep your hands clean. And sanitizers are very important at this time. Please remember to keep your social distance of at least 6 feet apart. And make sure that if you can, that you go out and become vaccinated. And that plea to you today. You've heard it from the doctors. The virus is in our communities. And so we are asking everyone to do their part, to make sure that you do your part. We've always said that it's an all of society approach. And so now we are asking you to do your part to protect your communities, your families, your friends, and your loved ones. Get vaccinated and make sure you continue to adhere to all the protocols that have been asked of you over the last year. So thank you once again. And again, we will continue in the Ministry of Health to do all that we can to keep you safe. And we want you in turn to do what you have to do to keep you and your community safe as well. Thank you.